put trust in our nursing home to take care of our loved ones, our grandparents, our parents, our relatives. And many of these nursing homes are fine establishments. They give the proper care. But every nursing home does not give the proper care. Many of the nursing homes have undertrained and staffs which are not in proportion to the number of patients that these workers have to take care of. A lot of these workers are dedicated workers. However, when you have one person taking care of 12 different patients or 9 patients, they just don't have the time to go from room to room to room and to give every one of their patients the time that they need. You must be the best advocate for your family or your friends that you're visiting in a nursing home. Your eyes must be open. If you start noticing abnormal bruising, if you start noticing lots of bruising, discoloration of the skin, you have to look further into what the cause is. Some of the elderly people cannot articulate what has happened to them. They can't articulate that they took a fall, or they'll forget. There's Alzheimer's patients who suffer with this, and they cannot help you out. What can you do if you go to a nursing home to visit your loved one and you see that the loved one is starting to develop bed sores, or that you notice that they've fallen? What can you do? These days everybody has smartphones. Most people have smartphones, they have cameras. If you do encounter a situation like that, A, let's take care of your loved one. Let's get them out of that nursing home. But B, let's get some evidence. Evidence being some photographs of the sores, photographs of the surrounding, photographs of the entire room showing that there was a lack of bedroll or the bedrails did not work, showing that there were no mats on the floor. Evidence like that. When you get involved with an attorney, that's one of the first things that we're going to ask. Do you have any photographs? Because when an attorney would go to a nursing home, or an attorney would send an investigator to a nursing home, at that point usually things are already repaired. You need to have that evidence. Many of these nursing homes are owned by big corporations. They are aware of the responsibility that they have to their patients, to their clients. They're operated for profit and they make decisions. When you get into a nursing home, immediately what should be done should be an assessment by the medical staff. And some of the preventions that can help people who are prone to falls would be the side rails. Side rails on the bed should always be up if you have someone who's prone to falls. Mats on the floor near the beds, so if by chance somebody does fall, their fall will be cushioned. Old people fall. Old people do not have to fall. You do not have to accept this as a normal plight of somebody in a nursing home. Anything less is unacceptable.